We are a couple of minutes after 6. We'll go ahead and get started. I'm really excited that everybody's here today. Thank you very much for joining us for our Ohio ISP for Family session, talking about the Ohio ISP service plan that's going to be coming out here in Ohio. My name is Corey Ferguson, and I'm with Family Outreach and Education in the Division of Policy and Strategic Direction. I'm really happy to be here with all of you tonight. As many of you may know, let me first step back, and this may be the first time some of you have used the Microsoft Teams platform. There is a place for you to turn your video on and off, as well as a place for you to mute and unmute your microphone. At this moment, we do ask you to mute yourselves for a good call quality for everybody. Also, there is a place for you to use a chat function where you can type questions in the chat. We will be keeping an eye on those throughout the evening. If you should happen to leave the meeting, there is a red leave button on your screen as well, and that is how you can leave the meeting should you happen to have to do so. One last note here is that today's session is being recorded. So we'll be recording the session and then sharing it with others who have not been able to join us tonight. So in Ohio, we have had individualized service plans for individuals that have all been county-based. So every county has had their own ISP, and we're looking to make a change here in Ohio. And Lisa is going to join me and talk about the Ohio ISP, which is going to be very person-centered. And we know that everybody on the team is essential and a really important component of providing services and supports. It really allows for one plan for all of Ohio, and Lisa's going to share that with us here tonight. I am really excited to share my colleague with us, Lisa, who is going to provide an update on what the OhioISP is, what it means for families, and provide general information about the Ohio ISP. As we move into our conversation tonight, I do ask if we can hold all questions until after the presentation. We will have time to discuss questions that you have. You're also welcome to put those in the chat as well. So Lisa, I'm really excited that you're here tonight. Thank you very much for joining us, and I'm really excited to turn it over to you for all the information you have to share with us.
Great. Thank you, Corey, and thanks for having me this evening. I hope everybody's safe. I had a power outage real quickly a little bit ago here due to some storms, so I hope everybody attending is safe and in a good place, and power and all that good stuff. I thought, oh goodness, let's not have this happen right now, right? So as Corey mentioned, I'm going to be sharing information about the Ohio ISP. We'll sort of walk through kind of where we've been and where we're at today. We'll talk about parts and pieces of the assessment and the plan. We'll show how they link. We'll go over all of the different sections, and then we'll talk about sort of what you can do right now in preparation for the Ohio ISP. And then, as Corey said, we will then transition into questions after the presentation. Hang on a couple of seconds and I'll be happy to share my screen and we'll get going. Okay, hopefully everybody's seeing the presentation, and I clicked audio, so there should be a video coming up that hopefully everybody will be able to see and hear.
So Lisa, we are not able to hear your video.
Okay.
Lisa, we're still not able to hear your video.
So I understand you couldn't hear the video. I'm not quite sure. I shared my audio and thought that we would be good to go. So we'll make sure that everybody has a link to the video. It is on the OhioISP webpage, but we'll make sure that you know where that is so that you can check out the great videos associated with the OhioISP. So I do apologize for that. We're going to start off talking about some core values that we took into consideration at the beginning of this project. And kindness and empathy, collaboration, transparency, innovation, quality, inclusiveness, and accountability. These were all core values that were established, as I said, at the beginning of the project, and we've worked really hard to adhere to them throughout this process. Kindness and empathy, all of our interactions are based on genuine care and concern for all involved, and that we engage in collaboration with each other and all of our partners. We at the department will be transparent. We will be accessible and visible in our business practices. Through technology and new ideas, we will be innovative. We will simplify and make our system more efficient. With regards to quality, the services that we deliver will add value. Inclusiveness, we want to cultivate an environment that embraces diversity, and every idea is embraced at every level. Accountability, we will conduct ourselves professionally and manage our tax dollars responsibly. We also had some guiding principles throughout this entire process. We wanted to simplify, standardize, ease of use for all frontline staff, and ensure that there was portability between counties, providers, ICFs to county boards to ICFs. So whoever the provider might be, that the person receiving services, their plan was portable to go with them. So here's a little back history, sort of kind of where we've been related to the OhioISP. And so this initiative took place and began back in early 2019. And I talked about those core values and those guiding principles. Some of you on this call may have even participated in some of the town halls that we had, where we talked about people's fears, people's excitement, about what it meant to have a standardized single service plan across the state of Ohio. And then in the summer of 2019, we began work establishing the external work group. And so we had representation from county boards, ICFs, families, people receiving services, frontline staff. It was a very large, diverse work group, and they started charging forward with their assignment, and they began working on the assessment template. We also collaborated with ODH along the way, the Ohio Department of Health, to make sure that we were in line with their regulations to support our ICFs along the way. And then we also developed some testing groups. And then in early 2022, we began doing some assessments, some testing on the assessments. We worked with the compliance department at the department to ensure that the template met all compliance regulations. After testing, we analyzed some data. We made some updates to the assessment, and then the work group began work on the actual planning process. In summer of 2020, the department identified their IT solution, and third-party vendors were acknowledged that they were wanting to join, and then we began finalizing testing for the OhioISP. After testing was completed, we did another round of analyzing some data. We did some updates to the Ohio ISP. And then in late 2020, we began doing targeted training for SSAs and QIDPs, which we continue to do today. In early 2021, we customized some training. We looked for feedback from the group who was receiving the training. And then we began the rollout of the Ohio ISP, which takes us to where we're at today with regards to full implementation. And as we have providers and county boards implementing the Ohio ISP as we speak today. So that's sort of a little quick timeline on where we started and where we got to today related to the Ohio ISP. Here's just a little bit of data for you I wanted to share with you. Over the course of the last couple of years, we had heard some noted concerns around the assessment taking a very long time to complete, right? And so I just wanted to show you the data on average that teams met on average 1.5 times to complete the Ohio ISP. And on average, it was taking about 4.5 hours. So in some ways, it kind of is expected that the first go round of completing the Ohio ISP, it might take a little bit longer than it has in years past, simply because of the in-depth questions on the assessment and questions that maybe teams have not addressed to date or didn't think about. But in general, 1.5 times meeting and for 4.5 hours total doesn't really seem to be too terribly excessive. Yeah. So I want to talk quite a bit about sort of the assessment, if you will. Again, standardized, simplification. We believe that the assessment should be done in a relaxed environment, that it should engage and empower all team members. Person-centered tools are embedded within the assessment itself to get to know the person, understand their abilities, and intuitive questions, asking the right questions that sort of drive natural conversation. We don't want this to be sit down and run through a million questions. We really want it to be conversation in nature so that we can then get really good, rich assessment information, not just from a provider, but certainly from everybody who's important in a person's lives, families included. You all want very much to know that the people that are supporting your loved ones have all the information that they need to be able to provide successful support. So these are the assessment sections of the assessment. So there's a communication section, advocacy and engagement, safety and security, social and spirituality, daily life and employment, community life, and healthy living. So within all of these sections, there are a variety of questions obviously associated with each topic. Certain questions will populate or will not populate depending upon your loved one's age. And you can also see that the terminology here aligns directly with the life course terminology that some of you, if not the majority of you, might also be familiar with. So this is what an assessment section looks like. So what I want people to know is that no assessment will go unaddressed. So if your loved one has an external professional that they're working with and they've provided the team with an assessment, I don't want you to think that that information is going to get lost, because there is the ability to upload all qualified professional assessments. So SSAs and QIDPs can upload any additional information that the team feels relative to the assessment process. There's an option at the end of each of those sections that we just reviewed for assessments to be uploaded. Assessments can include discovery tools. They're interwoven throughout the template. They certainly provide valuable information to the planning process. And you can see here on the example that's on the screen, it talks about the communication chart being uploaded into the plan, into the assessment, excuse me. So the assessment approach, right? You want to look at all the available resources for the person, paid versus unpaid, technology. There are examples at the end of each assessment section. So as you're going through and highlighting the important things in the assessment section, as the team works their way through, they will begin to indicate, does the person need help in this section? If so, no supports? Would it be paid supports? Would it be natural? Could we explore, and is there some technology that would help this person in this area? For example, in the area of communication, as we were just looking at on the previous slide, right? So assessment happens, then we move on to the planning. We don't spend time in assessment working on the planning section. We certainly want to spend all our time digging down deep and getting that rich information that's going to help us throughout the planning session. Right? So assessment truly does drive planning. So again, on the screen, you can see the areas of assessment, and then over to the right, you can see the important 2, important 4, skills and abilities, known and likely risk, what's working, what's not working. These are all the sections in the plan. So you take the information that's accumulated in each one of the assessment sections, and then that drives the answers. That information bridges over. That's the word that we sometimes use. It bridges over to the planning process. And information actually can be auto-populated from parts of the assessment over into the plan. Sections of the OhioISP, there's a one-page description, which is sort of a quick overview of the person, right? And what they want their supports to look like. And then again, there's summary sections, just like you saw on the previous screen, summary sections for important 2 and important 4, skills and abilities, known and likely risks. Outcomes and experiences, what's worked over the past year, what hasn't worked. Again, back to those services and supports. Are they going to be paid supports or other types of supports, professional referrals, right? And then, of course, there's the agreements, the informed consent, if there's restrictive measures in the plan, and some contact information related to important people, places, clubs, and groups. So I want to take sort of a closer look at an assessment section. And really what I want you to see here is I don't really want to spend time necessarily talking about the level of care or risks. What I want you to see is all the rich information that's in here about Sophia and some potential information that teams should have about risk of falling, where she might fall, where she has had some bad experiences, things that frontline staff absolutely should be aware of, absolutely would come out during the getting around conversation while working through the safety and supervision section of the assessment. You can see the information here then drives over to, this is the planning section, and it drives, all that information drives over into the plan. So you can see the same information that we saw there breaks the information down even further. So the person who's responsible to help support Sophia knows exactly what type of support she needs and what it might look like. And it also then identifies what the risk is, right? So there's a fall risk, and it explains when she's in the restroom what could happen, and that when she's in the restroom, she needs visual support. And then it says who's responsible for this level of support. Obviously, the DSP would be responsible in this case for this level of support. So I wanted you to see an example of an assessment section and then how it drives information into the plan. So the takeaway from this is that assessing, planning, monitoring, and revision, really that's what we see the most important part of the SSA QIDP being: assessing, planning, doing that ongoing monitoring, revisions as necessary. So again, so that you can think of this as a conversation loop, right? We're moving away from those one-time sort of big annual events and keeping this alive, breathing, living current document and allowing the IT solution to help us ensure that we can keep this conversation loop going all the time. Right? And so you might be saying to yourself, what are some things that I should be doing now to familiarize myself with the OhioISP? And so I would encourage you to begin conversation with your SSA or QIDP and talk to them about when they plan to begin using the OhioISP. I'd also encourage you to visit our webpage if you haven't already. There's a tremendous amount of resources on the webpage geared specifically for different targeted audiences. So there is specific information for families available on our webpage. I'll make sure that this address gets dropped into the chat for everybody to have. But I highly recommend that you go to the webpage if you have not had an opportunity to do so.
Lisa, can I interrupt you just for a second?
Absolutely.
Can you tell us what a QIDP means, please?
Sure. Qualified intellectual disability professional. It is somebody who works in the ICF world versus the county board world. They have a very similar role to an SSA, but they work in an intermediate care facility. So I hope that answered your question.
Thank you.
Yeah, certainly. So another thing that you can begin doing is ensuring that you have an OHID account, okay? And again, we'll make sure that you have all of these resources. We'll make sure that we get it to Corey and he can get all this information out to the distribution list so that you can go ahead and access the resources. But I did want to give you some screenshots of sort of what it'll look like for you when you log in to begin to set up your account if you don't have one. So you'd go to the Ohio DODD main page, click on the person icon, and then you'd begin to either create an account or log into an existing account if you have one. And then you'll know that you've reached the OhioISP because this will be what you will see when you log in on your dashboard. And then once you've been connected with your loved one's team by the SSA or QIDP, you will have the ability then to click into the plans to see the assessment, the plan, and then provide feedback. You will be able to sign documents in the plan. You'll be able to communicate directly with the team through the chatter function. So that sort of a brief overview, if you will, about where we've been and where we're going, and sort of next steps for you, for family members, on ensuring that you know where the resources are, how to get to the resources, set up accounts, talk with your SSA or QIDP about when the county board plans to start adopting the Ohio ISP. You certainly can familiarize yourself with the assessment and all the questions associated in the assessment, so that you can share all of the rich information that you have about your loved one back to the team for the assessment process. So with that said, Corey, what questions do we have this evening?
So Lisa, we have a couple of questions in the chat.
Sure.
One being, are assessments allowed to be uploaded even in the state or county as not a provider of the services, like behavioral health needs assessments? And that came from Lisa.
So are assessments allowed to be uploaded in the state or the county? It's not a So yes, so back to one of the slides I talked about ensuring that all professional assessments, external professional assessments, you could upload. So absolutely, any other assessment, even outside of the county service provider, you certainly can upload those assessments. And that would be, great information, obviously, for the whole team to have, for sure.
And then Rhonda asked, what is life course terminology referenced earlier in the session? And Rhonda, charting the life course is a framework with some tools that helps people determine what it is they envision for their lives and what they want for their lives. And people can have those conversations and use those tools and then have that and take it into an OISP conversation. And the language that we see in the charting the life course is also language that is built into the OISP. So the conversations and the planning that you do before your OISP conversation with the charting the life course tools just kind of flow into completing your OISP with the team that you're working with.
Correct. Even the
Thank you.
communication chart too, correct, Corey? Even the
Okay.
communication chart, yes. Mhm.
Yeah. Thank you, Corey and Lisa. But can I ask a follow-up question about that, please?
Yeah, of course.
So this life course, is it like forms online that you can go and access and complete that also prior to your meeting with your SSA? I'm just not familiar with that particular tool.
Right. So you know what I will do? I will put some information in the chat that has links, and it'll have videos where you can learn more about charting the life course, as well as where you can get some charting the life course training. And then I'll also include where you can get some of those tools for free as well.
Perfect. Thank you.
No, you're certainly welcome. And then I see Noreen has her hand raised. Noreen, do you have a question for us?
Sorry, I do not. That was unintentional.
Oh, okay. Yeah, well,
Thank you.
So Lisa, I don't know if you can see the chat or not. We do have a few questions there as well, if you want to tackle some of those.
Yep, I sure will. Let's see. So Amy Clausen asks about a fluid document. Thank you for the information. Is the Ohio ISP considered a fluid document and can be changed with major change events happen? Absolutely. Yes, it can be changed major or minor, right? So major changes would probably require a reach out to the entire team. Minor changes, the SSA or QIDP might go in and make a small update, but team members will be notified when changes have been made to the plan through the IT solution. So you would get like an email saying, hey, a change has been made to your loved one's plan. You can go in here and look at it. There's a change log that you can see when changes have happened. Okay, hopefully that answered your question, Amy. And then the next one, when creating an account on the website, is it under the individual or the guardian or parent? So you're creating, if you are the parent or guardian, you would be creating a parent or guardian. But I think what you might be asking, honestly, is at the top, across the top of DODD's webpage, there's click down boxes for individuals, families, and guardians. So you want to make sure that you're clicking on the family guardian, but you're also going to click on the person icon. I can try real quickly to bring that back up here. If you give me a couple seconds, maybe I can get back to that slide and reshare it again for us. I think this might be what you're talking about, but I could, so tell me if I'm wrong, okay? I don't want to share bad information. So I might not be getting it right. So you're going to click on up here. Were you asking about these up here, or were you asking about here and then creating an account?
Lisa, what?
Yep.
Asking about creating the account. Like when I create the account to look at the ISP, am I creating an account under my name as the parent, or am I creating the account under my loved one's name?
You're creating it under your name.
Okay, thank you.
Yeah. Mm-hmm. We're also going to have sessions where, so if your loved one's with you, they could create an account also, because we'll also be having sessions to help people through that process too.
Lisa,
Yeah.
we have a shared living provider that is a provider and a parent. So if you are both, then how would you handle that?
That's a good question.
She's also saying her daughter that would be interested probably in how she accesses it herself as well.
Yeah.
So we have 3 separate entries.
I'm going to be speculating here. Is there any way you could drop your contact information in the chat and I can make sure that I can get you accurate information? Because I can tell you 2 things. One, the shared living provider is going to be in the IT solution as a provider already, because they're a provider with the Ohio Department of Developmental Disabilities. So they're going to be in there as a provider and probably already have a provider account. It seems kind of silly to have 2. However, to keep those lines a little separate, I'm not sure. I will contact IT though and follow up with you if you're able to drop your contact information in the chat for me.
Thank you.
Yeah, of course.
I see in the chat, there's also a question about will a recording from tonight be available, and we will have this recording available for folks on the DODD website. Yes, Bill?
Mm-hmm. Yes, it'll be on that OhioISP webpage, and it will be under the Family Resources tab.
Lisa, will providers be able to access the ISP also?
Yes, yes, all providers. So what will happen is the SSA or QIDP will sort of, they'll set up the person's team. So you'll receive an invitation to join your loved one's team. The provider will receive an invitation to join your loved one's team. And then once the team has been set up and established, then everybody will have access to information, right? To the plan, to be able to communicate back and forth with one another. Now, I'll also say this, not everybody might not need full access to your loved one's plan. Maybe, maybe not. So maybe they have a transportation provider, let's say, that picks them up a couple of days a week and drops them off at work. They might not need to know all the ins and outs of the results of the assessment. So the team might say, I think we'll just make sure that this provider gets information that they need that's relevant to them. So they might not have access to all that personal information. And that's an option for teams to discuss who all should have access to what and how much of it.
So Lisa, one of our questions is also, as this is called the Ohio ISP, is there a different plan for each state, and is this driven by the federal government?
It is not driven by the federal government, and I cannot answer for any other states.
Are we able to refer to Medicaid services and referrals on the ISP document?
Are we able to refer to Medicaid services on the document? Do you mean listing waiver services? I just want to, again, I want to make sure I understand your question.
So that question came from Lisa. I don't know if Lisa wants to unmute.
Hi, it's Lisa.
Hi, Lisa.
Typically, or sometimes I should say, Medicaid services are just viewed as separate from other services that you may get from the county or the state. So they might not be, I don't know. I hate to speak so generally. I've just often heard the phrase, we don't take care of we're not Medicaid, we don't do Medicaid services. So I don't know if Medicaid services like a behavior or a speech therapy or anything else would be included on this new ISP document.
So would you be getting a report from that particular service? Would they be considered a team member?
Potentially, but I guess I'm asking you, moving forward, is this a new way of considering them a team member if I have outside providers?
Yes, I mean, I think that your loved one and with your support can determine who all they would like to be a part of their team. And remember, and that hopefully should have always been the case, right? The team should be driven by your loved one. So, and I guess I would say if there's information that is not covered in the planning process, don't forget that you can always upload additional information so that it is a part of the plan.
Okay. Okay. Thank you.
Yeah.
Lisa, Henry asks, will my brother, sister, and I be able to register an account for our loved one?
Yes. Absolutely.
And another great question here, by what date will the entire state of Ohio be using the new Ohio ISP tool?
So we're asking everybody to hop in by September of this year, meaning that they have to get in using it by September, and then they will have a year to get all in and then a year to transition. Okay. So there should be some discussions hopefully going on with you and your SSA or QIDP.
Thank you, Lisa.
Mm-hmm.
Another question, are guardians required to be notified when changes are made?
So that's a good question. So we talked about this briefly just a second ago about sort of massive changes to a plan. All sort of team members should be notified if there's been sort of a big revision to a plan. If you're making a small minor tweak, possibly not. Something huge changes in a person's life, a whole different level of type of support needed, then absolutely people should be notified. Small little tweaks, possibly not. But remember, you'll also get notified, right, when there's been changes made through the IT solution.
Sandy asks, where can families obtain a blank copy of the Ohio ISP?
They can
And would that
obtain
be
a
the
blank
same
copy.
assessment?
Yep,
Go
they
ahead.
can obtain a blank copy on that Ohio ISP webpage. I will drop that in the chat. before the end of this meeting, I promise. And you can go on there and download a copy. And like I said, I would recommend reviewing all the questions and taking a look at the assessment section. Begin filling it out, being prepared for the team meeting.
If county boards are using a third party, can the SSAs and Qs still communicate using chatter?
They can, the SSAs always will have access to Salesforce. Okay, they'll always have access to Salesforce. If they're entering their information into a third-party vendor, I do not know if the third-party vendor has a chatter function. I do not know the answer to that. I know that DODD's Salesforce IT solution has a chatter function.
Looking through the questions here, we've
Looks
talked
like
about
we've
the
got
chatter function.
a couple people with their hands up too, maybe Corey.
We'll get to those here very shortly. One quick question for you.
Yeah.
Do we have to use a sign in and use and create an account?
In order to be able to access the IT solution, you have to have an OhID account.
Okay.
For security purposes.
Thank you, Lisa.
Mm-hmm.
David, I see you have your hand up.
I'm assuming when you talk about that the team decides, what areas other team members have access to, and that in the same way that based on changes in services or family situations or whatever, access can be removed once it's granted and something changes.
Yes.
Okay, and then
So to simplify your question, David, you're saying, hey, Lisa, my loved ones might have provider X, Y, and Z, and they no longer have provider X, Y, and Z. They have provider ABC. Is X, Y, and Z no longer has access to my loved one's plan, correct? And
yes.
The answer is yes, that is correct. Yes.
Okay, and then kind of a follow-up. How does the new ISP impact behavior supports and behavior plans, especially if it involves either non-restrictive or restrictive interventions?
Well, so we hopefully nobody has a separate behavior support plan. So per the behavior support rule itself, behavior supports should be interwoven throughout a person's plan. So we would expect that the behavior support strategies, whether they be positive or restrictive, that they be interwoven throughout the OhioISP, much like they should be now. There is a section on the OhioISP at the end around informed consent, which is obviously a big part of behavior supports, ensuring that people understand and are informed about what they're agreeing to, for sure, with regards to restrictions. But again, I'm going to go back and sort of repeat myself in the sense that these strategies are called out and how they support a person, much like we saw on the slide where it talked about Sophie's needs in the restroom. You might see a similar strategy called out there where it might say, when Lisa's out in the community, she has a tendency to do unsafe things, and it's important for her that you walk close to her and maybe put your hand on her elbow. For an example here, you'd see that called out in the safety and security section. And then you'd see, just like you saw for Sophie, you'd see how to best support, what the intervention is, and who's responsible for that particular intervention.
Okay, yep. I appreciate that. And just an observation, am I the only one that finds it a little ironic that for an individual service plan, we're standardizing how we do this? Just an observation. Thank you.
Yeah, thank you, David. Thank you.
And I see Hope also has her hand raised. Hi, Hope.
I can't. Hello, can you hear me?
We can.
Yeah.
So here's my question. I come from the school environment and my son is in a group home. My question for you is this: is an ISP as legally binding as an IEP would be? And if it's not followed, what are the repercussions for that?
Well, unfortunately, I don't know enough to know all the ins and outs of an IEP. I'm sorry about that. I mean, I can say that if a provider is authorized to provide services and they sign on the dotted line, then the expectation would be that they provide those services.
But what are the repercussions if they aren't followed? Are there any repercussions through the state at all?
There are a variety of different interventions. There can be, even at the county board level, there can be compliance reviews completed on the provider to determine sort of what their barriers might be to providing the service. Are they a willing and able provider? And then the state also has the ability to do compliance reviews. And then as a result of those compliance reviews, several different things can happen. And it's all sort of contingent upon the areas of citation, the numbers of citation.
Thank you.
Mm-hmm. There, just so you know, Hope, there is a protocol on DODD's webpage related to compliance and compliance reviews if you're ever interested in looking at that, just so you know.
Thank you.
Yeah, sure.
Thank you, Hope. And Rhonda?
Yeah, I'm sorry. I know I already went, and this isn't a question, but I would be remiss if I didn't just say how wonderful I think this is going to work so much better. And I've been dealing with ISPs for a long time with my son, and the paper copy and the meeting once a year. And even though the SSAs do keep in contact, I just think this interactive online IT system, as you call it, is going to be wonderful. So thank you and your teams for doing this. I really, truly am excited about this.
It's wonderful. Thank you for sharing that. We really mean it when we said we really did want to simplify things, right? Like we work hard to do that, and hard to make sure that people who are helping support your loved ones know what they're responsible for, because especially those providers that work in multiple counties and having to figure out and cipher a variety of different plans, and just want to make sure that everybody understands what it is that they're responsible for, and that every team member's voice is heard all along the way.
And Mary McKee, you have your hand up.
You hear me? I put the little question in the chat side, but the basic it's just, will the chatter function replace our little paper notebook day to day that goes back and forth between the House and the OOVC? I just want to be, with it. If I'm supposed to be chatting instead of noting.
Okay. Thanks. Sorry, I wanted to wait for that feedback to stop. I do not know what sort of policy or procedure you might have with the provider agency, right? So I think that's a good conversation for you to have with your provider agencies. If that's a system that you currently have in place, I would talk with them about how they then plan to go forward with communication.
Lisa, we do have a couple of questions in the chat. One is, does this document meet all Medicaid requirements?
Yes, it does. Yes, it's been reviewed multiple times. I indicated when we were going through our training about review from compliance, right? So we've had compliance reviewers involved all throughout the way, ensuring that the document meets compliance in every area. In addition, I talked about ODH, right, too, and looping them in. And so it meets all Medicaid tags and all waiver responsibility.
So we only have about 5 minutes left of our time. I'm going to give Teresa and Denise a quick chance to ask their questions, as I do see their hands raised. Teresa, how are you this evening?
Good, thank you. If I upload a document from an outside evaluation, whose responsibility is it then to review what I uploaded, and what are next steps after I upload that document as a family member?
The team is responsible for reviewing the document and then pick out what parts and pieces of information should be included in the assessment or should be a part of the planning process.
And Denise?
Hello, can you hear me okay?
We can.
Yeah.
I apologize. I have my mobile device on as well, and I keep trying to turn it off there so that you don't hear an echo. Is that bothering you or just me?
We do not hear it.
Okay, good, thanks. I wanted to follow up on, I think, the same thread of an idea with Rhonda's question when she was talking about an IEP versus an ISP and accountability. So this is something that I've been struggling with, and I'm not sure if her question was as specific as mine, but I also have that same history. And I've been concerned about the fact that I'm both a parent and a provider. I've been a provider in many, many years for other individuals, and now shared living provider for my son. Here's the concern as far as the accountability aspect. You know, as you know, we have to have compliance reviews, and we have a strict accountability process that we all follow. And yet other paid supports, for example, a day program, DAHAB program, that gets paid by the county to provide supports. There is, I've been told, even after talking to several SSAs, that basically they're private paid and there really is no accountability. There's been many times with other individuals I've worked with, as well as my own son, that they were not following the plan and that there were other concerns as well. And it's like they were just able to do whatever they wanted because there's hardly any open, there's hardly any availability, there's wait lists. And it's like, well, if you don't like it, you can just, you know, get another one. But I never did understand why we're held to measures that other paid individuals through the DAHABs are not.
Well, I can't answer a ton of that. I can tell you that all certified waiver providers, whatever area you're certified in, so if you're certified as a day provider, you are subject to a regulatory review upon certification 1 year after, and then 3 years after that.
I guess what I'm asking is about, you know, in an individual case, we're supposed to be a team. So if my son, for example, or another individual that I serve if their services are not being addressed. For example, if they have specific communication needs that are
Mhm.
not being addressed, that's a basic right to be able to have
Yes.
the individual have supports to communicate. You know, we
Mhm.
go through all this training on the rights, client rights and so forth.
Mhm. Mhm.
And yet what I'm finding is that, well, they can only choose one thing to work on. And that if, you know, if that's a minimal effort, it's, I don't want to be critical, but I don't know how else to put it gently. Just basically that if other situations, that would be a problem and it would be dealt with. But in the day habs, I'm being told, well, there's really nothing we can do about it. They're private and we really can't do anything about that. And I'm just wondering, is that a valid statement? And how does one address it if you feel that this individual is a service provider, they're being paid, and they're not following the same type of protocol that we're trained that we all have to provide?
So Lisa, real quick, we are out of time. We are going to
Mhm.
close here at 7. Denise, I'm going to reach out to you individually
Okay.
and see how we can support you.
Yeah.
So I'm happy to do that.
Mhm.
Lisa, so what would be the best way for folks to connect with other questions that they have about the OISP?
Yep. I will drop in the chat the link to the Ohio ISP webpage. And then I will also drop in the chat the email address for the Ohio ISP mailbox. And so you can email all your questions directly to that mailbox. And that mailbox is checked twice a day. And so we'll hopefully get back with you really quickly with regards to your questions.
Thank you very much, Lisa. So I do appreciate everybody being here with us this evening and for the questions. We are going to go through this chat list we have here and take some of these and create a frequently asked questions as a resource that'll be listed within that Ohio ISP webpage that Lisa had referenced earlier. But again, we really appreciate everybody being here. We look forward to connecting with you and hearing from you with that email address that Lisa provided.